Hi, I want to introduce you to my new favorite toy. This is our Juliet Laser by Cutera. The Juliet Laser is designed to improve the moisture, sensation, health, and function of the vagina. So this is what it looks like. This is the handpiece that would be individual for each person. This plastic sleeve is actually disposable. We throw it away after each use. And you can see that this goes inside the vagina. We measure the length of the vagina all the way to usually about 8 to 10 centimeters, depending on the patient. You can see this little window at the end. That's where the laser light's going to pop through and hit the tissue. Now, what happens is the laser pops around in a little circle. When I had it done, it feels a little bit like a woodpecker. Pop, 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 pop around in a circle. And then we withdraw it 1 centimeter, again another circle, withdraw another centimeter, and so on, so that the entire vagina is treated with laser all the way back to the opening. And then it's placed back inside to the top of the vagina, and a second pass is made. Now, this is an erbium laser, which is actually making little channels into your tissue. It's a controlled injury, and what happens when we do that is it stimulates new tissue to form. So we get new blood vessels, we get improvement of nerves, we get more moisture. So even for patients with breast cancer or patients who cannot take estrogen, the Juliet Laser with 3 treatments a month apart can completely restore a dry, painful vagina to a moist, elastic vagina so that you can enjoy intercourse again. Now, not only do you have vaginal dryness, but you also might have some dryness on the outside. We would then take off this head and switch it to the external head, which looks like this. Now, the same erbium laser is used, and this is just used to pop, pop, pop little squares on the skin, which is again making lots of little micro holes in the tissue, controlled injury. We put local anesthetic on the outside so that it's not painful. What to expect afterwards is that you feel a little irritated. When I had it done, it felt a little irritated. You have some discharge for a few days, no intercourse for 3 to 5 days, a little bit of aquaphor on the outside. But then the new skin, the new tissue develops underneath. And even with 1 treatment, I saw a great improvement in my own tissue. With 3 treatments a month apart, it makes an incredible difference. Now, do you have to have breast cancer to have this done? No, I don't have breast cancer. I did it because it improved my sensation. As you can imagine, when this is going around the inside of the vagina, part of it is treating that area at the top that we sometimes call the G-spot. So it improves vaginal sensation, ability to orgasm. It also gives a little bit more tightening effect because in making more collagen inside the vagina, you can imagine that that creates a little bit less laxity if we have some mild vaginal laxity. The other thing that's really cool is because it's putting some collagen right at the top of the vagina that supports the bladder, it can improve stress incontinence. So many benefits from this. It takes 10 minutes, it doesn't hurt, you can drive yourself home, you can go to work the next day. It's the best thing since sliced bread.